Hey there, guys. How you doing? We're going to be finishing up this chapter now. We were talking about chest injuries is what we're talking about now. Abdominal injury. So this is the last portion of this chapter. Once we're done here, obviously we'll be taking a test soon. I'll make sure you guys have all that information before we get there. Let's start out with this abdominals. Okay, so we've done a project in class. You guys had an opportunity to draw the abdomen and identify hollow and solid organs where they're actually located. We know now that the abdomen is actually divided into quadrants coming down the center, the midline, and transverse across the umbilicus, creating two quadrants. We got the upper right, upper left, lower right, lower left quadrants. Um, so, what's the difference between hollow and solid organs? Solid organs, as we should understand now, contain large amounts of blood, which mean in this case, when there's injury to these, we have a good chance of bleeding out. Kidneys, so you got the liver, the kidneys, we've got the pancreas, and so these are the ones that are solid, and we can bleed out from this. Okay, and then we have the spleen off the side here, and then we have the hollow organs. Hollow organs are simply that they're open on the inside. They will bleed if injured. They're not going to bleed out to the point of life-threatening injuries. They are filled with toxins. So typically, we're going to have spilling of toxins into the bloodstream or into the system, which is going to be agonizing, is going to be life-threatening, but it's going to take longer periods of time. And surgery should be able to manage most of those types. Frequent complaints. When we're talking about abdominal pains, we're going to see people that complain of this over a period of time. It's not something that just happens out of nowhere. And please understand something: if it happens out of nowhere, we're looking at what's called a acute situation, and in that respect, it's not a good thing. Can indicate a serious problem. Any abdominal pain that a patient has, we really have to look at as being something serious. Let me move myself so I can see all of this. Isn't that a wonderful picture over there? Okay, so occlusive dressings. We already discussed this, and what we're looking at here is what we call an eviscerated organ. And occlusive dressing, complete occlusive, is what we're looking to do. The evisceration, we're going to do a couple of things. We're going to clean away debris, cover with moist, sterile dressings, and then an occlusive dressing. Prevent heat loss. Do not allow organs to dry out. Never push organs back into the cavity. They are out. We cannot push them back. We leave them where they're at. We are going to simply, at this point, wash it off. We got a bottle of water, put it over the top, clean it off, get what we can off. We don't have to go crazy about debriding it or anything. Just get it cleaned off. We're going to take 4x4 gauze pads, or really we're going to take what's called an abdominal trauma pad. Okay, we're going to cover over the entire organ, and then the actual pad. In fact, give me just a second. Sorry, guys, trauma kit here. Let me find it real fast. Brought this home for a reason. Perfect. Okay. So we have is the trauma pad. Okay, trauma dressing, as it says right there. This trauma dressing, here's the actual size of it. Okay, the actual package. And then when you open it up, inside is this pad that can be used like this or like this. Okay, fold it in half, whatever you need. So we would soak this with water. It's going to absorb quite a bit of water. This could be laid on top of that injury, which you're looking at right here. Okay, and this is going to keep it. Two things happening. It's going to keep it from getting more dirt on it. Okay, so keep it from getting infected. That's what I was trying to say. All right, keep it from getting infected, but it's also going to keep it moist, because remember, those organs are coming from a moist environment, and we want to keep it that way. If it dries out, that's a big problem. Now, we're going to create the occlusive portion of that. We can go back to this. This has that plastic coating on the outside, which unfortunately is torn a little bit too far, but we could simply place this over the top of that tape all the way around, and that seals the moisture in and seals the organ in and keeps it out of the environment. So that is a trauma dressing and how we would use it in an eviscerated organ. Sorry. Impaled objects, never remove impaled object. We should understand this by now. Stabilize the object. We want to secure it in place, and sometimes taking a couple of roll gauze bandages, placing at either end of that, wrapping around that object, and then using that curlic to figure eight wrap around the impaled object will hold it in place. Do not apply direct pressure to the object. if putting pressure on it, we're just pushing it deeper inside. We don't want to do that. Consider the risks of internal bleeding. Signs and symptoms of internal bleeding would be pain and tenderness, distended abdomen, rigid or guarding of the abdomen. Rigid meaning it's tight, stiff, and that's probably from swelling. Guarding is where a person will tense up their abdomen or they will move their hands over or try and push you away. That's guarding their abdomen. Bruising to the abdomen, back and flank. Remember, the flank area is where the kidneys are. It's going to be the side back of your abdominal cavity. Pain radiates to the shoulders, and blood in vomit, urine, or stool. We're looking for shock, signs of shock. Gastrointestinal bleeding within the esophagus, stomach, or intestines can present a life-threatening situation. Bloody vomit or stool, coffee ground appearance with or without pain. So when we are looking at coffee ground or the other one's dark tarry stools, okay. So vomit would be coffee grounds, dark tarry would be the stools, and so these tell us specifically that these bleeds have been going on for a long period of time. They are actively happening at the moment, and they've been going on for a week or so, or maybe up to a month or so, because they're digested. Coffee ground, emesis, dark tarry stools. If it is bright red vomit, blood in your vomit or in your stool, it's an active bleed happening right now. Another question, is this with pain or without? You're going to the bathroom, especially if you're urinating and you're having pain and bleeding while you're urinating. This is going to tell us a good chance you've got kidney stones. Okay, that's a possibility. There's other possibilities, but that's one thing we're looking. So here's what we did a while back. You guys had the opportunity to do this. I'm going to move myself over. You see the right upper quadrant, right lower quadrant, left upper quadrant, left lower quadrant, all the organs associated in those areas. These are the areas where we're likely to receive injury. How we can identify, are we looking at internal bleeding, or is there some other injury that could be causing problems? Again, upper two quadrants carry our actual blood-filled organs. So this is the area I'm most concerned with when I have rigidity, tenderness, or uh, um, distension or guarding is what I'm looking for. If I have those up in this area, that's concerning me and telling me there's a good chance they're bleeding internally. If I have that kind of stuff happening down here, I'm not overly concerned about bleeding. I'm not ruling it out. I'm just saying it's not a big one on my list. I'm more concerned with toxic spills within the body. And what do we need to do here? Consider potential for underlying injuries, treat airway and breathing aggressively, provide oxygen, treat for shock, control any bleeding you actually can control, treat open wounds appropriately, position the patient, and reassess, kind of go back over everything. And guys, that leads us to the end. Thank you very much. So we're finished up here. I'm going to go ahead and load this up. You guys will have access to it. I will send the entire PowerPoint as well. Look for another assignment coming up, and we'll be talking soon about what our test is going to be. Okay? Thank you very much, guys. Take it easy. Bye.